Hey guys, this is Avi here from Precision Physiotherapy and Hamilton Physio and Rehab. Today we're going to talk about uh, AC joint injury and what to do about it or how to fix them. So AC joint, as some would know, some would not, is called as an acromial clavicular joint. So a lot of anatomy there, but it's basically one of the shoulder joints here. So our shoulder is made up of a lot of different, it's a complex joint. It has a lot of different moving pieces, which is our arm bone, humerus here, our shoulder blade, which is the scapula. Then we have the most underappreciated bone, which is the collarbone. Then we have our chest bone here as sternum. And then we have our thorax, our ribs. They all together, and even some parts of our spine, cervical spine, that is our neck, together make up this shoulder complex. Now, one of those joints, which we call this as an AC joint, then the name, it's an acronym of these acromioclavicular. So this shoulder blade has this particular bony landmark that actually travels and then goes around this shoulder area where it attaches to the collarbone. Up around this area, when you palpate, just up around the collarbone where it ends, that's the joint called as an AC joint. Now, there are a lot of different instances that this particular joint could be hurt. The most common mechanism of the injury for this is, when you've had a fall, and especially, and most fall, as we know, happens with an outstretched arm. So in those cases, you'd end up hurting some other areas or dislocate the shoulder. But if at all you land on the shoulder with your arm tucked inside, it almost gives a lot of thrust and a pressure on that particular area where it displaces the way that our clavicle or our collarbone is attached to our shoulder blade, and it almost causes a deformity where we call this as a piano deformity, where the collarbone is almost hanging up there, separated from the shoulder. Now, the severity of this separation makes us grade this severity of this injury, and there are gradations from grade 1 to grade 6. The grade 1 being the least severe to the most severe as grade 6. Now, the anatomy of this joint is that there are capsules that encompasses this particular joint, and then there are ligaments. Ligaments are basically soft tissue structure that connects from one bone to another. People usually get confused between what's a ligament, what's a tendon, what's a muscle. So muscle is something that allows us to do a certain movement, any action. Tendon is the end part of a muscle. So a muscle would convert itself at the very end into a tendon and it attaches to the bone. So it does play a little bit of a role in the movement aspect, but they're not the muscle tissue. And then there are ligaments. Ligaments actually does no certain movement. What it does, it provides stability, because it's like a rope connecting to wooden sticks. So it's like if if these two are my bones, then a ligament would do that. So any kind of force on that area would rupture or would tear these ligaments and then would separate the joint. And hence the most common problem that we see is called as an AC joint separation. The good part about the AC joint, so based on that severity that I was talking about, from grade 1 to grade 4, people respond really, really well to the conservative management. That means physiotherapy, more often than not, will always do the job for them and get them back to their pre-injured level. Grade 5 and grade 6, where there's a complete separation, there can be a conversation about having to go through a possible surgery. So now, what are the symptoms? So before we understand the symptom, it's important to know how does our shoulder works. So our shoulder has a range of motion from 0 degrees to all the way to 180 degrees. 0 to 30 degrees of motion is done by mostly our shoulder blade. That's the one that helps us in initiating that movement. From that 30 degrees to a 120 degrees is done with our arm bone and our shoulder blade, that is the glenohumeral joint, the shoulder joint there. And then that last part of that overhead movement this is where our clavicle plays is a very important role. It actually elevates and then rotates, so it goes up and then turns back a little bit, so that it allows this full range of movement. So imagine if that joint is separated, now the clavicle just do not have the stability to be able to allow this movement. So more often what people will say is that, hey, I'm fine doing movements at this level, but then when I'm reaching at this top level, it just doesn't feel right. You know, it feels uncomfortable and painful as well at times. So some suggestions, so people who are lifting and then they would often have this sort of an AC joint problem as well. You know, at this level, what I often have recommended is just to open up the joint and then rotate their arms outwards and then create a window between their arm and this. So it's like a window that you create and then keep it at this level and then you lift. And oftentimes people would say that, oh, that feels a lot more comfortable. So that's just one of the strategies for people who are dealing with this pain and then they are doing overhead movements. Now, what do we do? Of course, when you're dealing with a problem like this, you'd want to know that, okay, there are certain exercises, certain movement strategies, certain pain relief suggestion. There's some reports about doing some taping techniques. So taping works like as a neuromuscular feedback around that area, provides a little bit of a stability around that area, especially when it is acute. You've just hurt it. Taping has shown to show some benefits there. Of course, those taping techniques has to be done by one of the educated health professional who is expert in treating AC joint pain, but that's supposed to be helpful in terms of exercises. So we need to understand the science behind these exercises. So certain movements that are actually painful in the AC joints are the ones, like I said, in the overhead movement, and then the other ones is anytime people are doing some cross arm movement. So when they have to reach across the something, we see that in a lot of baseball pitchers, especially once they've thrown, and then at the very end of this, it is the AC joint that actually provides that eccentric stability and control, and that would often be painful for them. So if you are home and you're not sure, you haven't seen a health professional, you want to just test it out, saying that, okay, is my shoulder problem really an AC joint problem or something else? So just a few tests that you can easily try and do. Of course, you can't completely conclude it, but at least you can have a fair sense of an idea that it may be an AC joint. So when you're communicating with your health professional, it may be a helpful conversation to have. So when you keep your arm in this sort of an internal rotation position, and then you got to resist the movement. So the idea is that you're with this arm, you're trying to move this arm across the chest while this arm is actually pushing it back. So you're actually resisting this movement. And if it causes any discomfort and pain around that AC joint, then it could be a possible AC joint problem that you're having. And then the second test that I would do is doing an across the arm movement, and as and when you do this movement, you're like, that just doesn't feel right and it's painful. Any kind of horizontal adduction, those would often suggest it to be this problem. We call this as a scarf test. So now if you've concluded that this is an AC joint problem, now what do we do about it? So one simple exercise is the idea is to rotate the arm a little further out, get that stability around that AC joint. So this particular movement with a resisted TheraBand as and when you go out, because we know that when this movement is painful, you got to go in the opposite way. You're creating strength in the opposite muscle group and providing stability in that scapulohumeral and then the acromioclavicular joint. It's the returning back, it's a slow returning back, that's really, really important with this particular exercise. The second one is we want to work on our cross arm movement. So going opposite, so if this is the arm that's hurt, we're going to hold the band like this, palm facing up and then going up like this. Again, palm should be facing up and not down and inward like this, because that could be a little painful and uncomfortable. And then you'd want to come back down with, again, your palm facing down. If at all there are certain ranges where it's uncomfortable, you want to increase the length of this so you make it a little easier on doing that particular exercise. So that's helpful. And the third is, of course, there are different phases of this. So you can't do this right away when you are hurt yourself. So you're going through a phase as and when you improve, you're challenging the tolerance of the AC joint. And then the higher level conditioning exercise is you want to put the shoulder in that specific targeted position where it is loading that AC joint in a certain way. So in this sort of a position, so you remember this was the movement that was kind of painful, or in this angle. So you want to go in this angle, and then you want to load that AC joint, go all the way overhead movement, and it's about slow, controlled lowering down. All of these exercises to be done, 12 repetition, 2 sets, 2 times in a day, 3 every alternate days of the week, and we can change the frequency and intensity based on that specific condition, the person, and the injury that they're dealing with. So that's all about AC joint. If at all you have any follow-up questions, it's a complex joint to treat. Please do seek the advice from a health